Hello friends, welcome to Cortex YouTube channel. Have you ever come across a patient presenting like as shown in the picture? So what has happened actually in this figure? Let's see. So right eye is looking normal. So right eye is normal and left eye is, what happened to left eye? Look at this, what happened? It is downward. So it is downward. Second, what happened here? It's not in the midline, it's gone outward also, so it is outward, deviated downward and outward. And look at the pupil. If you carefully observe pupil size, what happened here? Pupil size, look at this pupil size and look at this pupil size, it's a little bigger or it's midriatic. So there is midriasis, means dilation. Midriasis. So if you combine all these features, they tell about a nerve involvement. What is that nerve involvement? Comment below before I tell. Okay, this is nothing but third cranial nerve palsy. Okay, third cranial nerve palsy, downward and outward eye with dilated pupil. Okay, so this is complete paraparesis of or complete palsy of third nerve. So there are so many causes for third nerve palsy. Third nerve originates in the midbrain. So there, any abnormality of midbrain can cause third nerve palsy. It enters the subarachnoid space. It runs between two vessels, and because of that, it is vulnerable to aneurysms there. And it enters cavernous sinus. In the cavernous sinus, like cavernous sinus thrombosis, carotid artery aneurysm, all this will cause palsy. So in this video, I am going to talk about midbrain pathologies causing third nerve palsy. So how to approach whenever you see third nerve palsy? Look for the let's suppose you are seeing left third nerve palsy. So look for the right hemiparesis, that is right side weakness of the upper limb and lower limb. So if there is contralateral hemiparesis, in this case it is right contralateral hemiparesis, weakness of the one side of the body, it suggests Weber's syndrome. Okay, and if hemiparesis is not there, look for the contralateral abnormal movements like in the form of chorea. Choreas are nothing but your rapid involuntary semi-purposeful movements, and they can involve both proximal and distal muscles, and there is no pattern, non-pattern. So rapid involuntary non-pattern involving semi-purposeful, involving both the distal or proximal muscles, chorea. Then athetosis, these are abnormal writhing movements and they are slow compared to chorea. Chorea are fast or rapid, athetosis are slow and writhing movements, twisting and bending movements like that, and involves mostly distal muscles of hands, and it can also involve arm also. Next, tremors. So these are the abnormal movements. If you are finding abnormal movements on the contralateral side, like in this case it is right side, so this is suggestive of Benedict syndrome. Okay, so there is no paresis, there is no abnormal movements. If you find contralateral ataxia, imbalance, especially cerebellar ataxia, you are dealing with something known as Nathan-Nagle syndrome. Okay, and if there are features of both Benedict's and Nathan-Nagle syndrome, like chorea, abnormal movements are also there, plus cerebellar ataxia is also there. So abnormal movements, ataxia, alright, abnormal movements plus cerebellar ataxia. So we are talking about what is known as Claude's syndrome. So these are four important midbrain pathologies resulting in ipsilateral or third cranial nerve palsy. So these are all contralateral features: hemiparesis, abnormal movements, cerebral ataxia, abnormal movements plus ataxia. All these are contralateral features, ipsilateral third nerve palsy. So whenever you come across this type of presentation, look for this one of any things. If that is there, your localization becomes midbrain. If they are not there, you have to search in subarachnoid space or cavernous sinus. So in cavernous sinus, other cranial nerve environment will be there. So hope you find this in video informative. If so, please like, share and subscribe. Thank you.